questions is, do I need a breast lift or not? So it's really easy. You go home, stand in front of your mirror, and without a bra on, obviously, and then look at the position of the nipple as it relates to the fold of your breast. So you can actually just get a little pin and just mark where the fold, which is basically where your breast attaches to your body. So you feel that underneath there, make a little line basically, and then look at the nipple position when you're standing or sitting. If the nipple is above that line, you do not need a breast lift. If the nipple is right at the line, usually we do the breast augmentation first, because as the implant settles and drops down to the pocket, the nipple will actually auto-rotate up a little bit. So most patients are like, hey, if I can get by without a visible scar on the breast with a mastopexy or breast lift, I'm all for that. So, however, if the nipple is below that line, we need to do a breast lift. So Dr. A and I just completed a book chapter on mastopexy, and the degree of drop of the nipple, or basically the distance from the nipple to the fold in section here, the lower it is, the more of a lift you need to do. So basically, if it's within about an inch, we can get by with just an around the nipple lift, where we take skin from the top of the nipple, and then we keep the nipple attached. We don't detach the nipple from the body. Also, doing a mastopexy does not decrease feeling to the nipple. Nerves don't come through the skin, they come in from underneath the breast. So having a breast lift does not decrease sensation or anything like that. The implant in position can kind of put pressure on the nerve that goes to the nipple, so you can have some short-term numbness. Almost all patients have, and regain normal feeling sensation to the breast though. If it's lower than an inch, then we do a little lollipop where we make a little extension where your nipple is now. We kind of bring that skin together. And if the nipple is more than a couple inches below that fold, we really need to do more of an anchor mastopexy or a full incision. Everybody always gets their undies in a bunch about the vertical scar. That's the one that heals the best. Particularly in Caucasians, it blends into the background, but even in type 5, 6 patients, that's the scar that looks the best or heals the best. The other incisions are underneath the breast and really not visible. So it's really just the around the nipple scar that you see. Well over 90% of patients, it just heals as a nice hairline scar. So really does take an examination, and we bring that in. I would say on average, about 20 to 30% of patients will come in and need some sort of a mastopexy for their first time augmentation. It doesn't really depend on age. There's some very young patients that need a breast lift as well. So it's not solely on age. So that's some of the things, nuances that we'll look at, whether or not you need a breast lift or not.
Can you talk me through a breast reduction?
Breast reduction. So breast reduction means different things to different people. A breast reduction can be a full mastopexy. It's really the same sort of situation and surgical technique that we use, similar incisions, and that a breast reduction is the removal, though, of actual breast tissue. If we do a full mastopexy, a lot of patients may want to maintain the volume of their breast, or actually add a little bit more volume to particularly the upper part of the breast. And so we just take skin and fat. I always tell patients that just for a mastopexy, it's not really reducing the breast volume unless you want that reduced. It's similar to taking like a quarter of the pillowcase off the pillow. It doesn't really reduce the volume of the pillow at all. A breast reduction actually removes breast tissue. So it can be a little bit or it can be a lot. I think my biggest reduction was in a very young patient, about 2.5 kilograms per breast. So just bigger than basketballs. I mean, just very, very large. The average breast reduction amount is usually about a pound and a half, something like that. It that range. But patients that classically, when you think about a breast reduction, you think older time frame where insurance used to pay for breast reductions. It's very rare that insurance will cover breast reductions today. If they do, the reimbursement is so low that it's hard to find a good plastic surgeon to do your reduction. So unfortunately, that's where we are today with the state of that. But essentially, a breast reduction removes the outer periphery, or the outer portion of the breast, particularly the outside and the inside of the breast, and narrows the breast. So wider breasts can look a little matronly. So we want to narrow the breast and provide more volume in the upper part of the breast. And then we keep the nipple attached. There are multiple different ways that the blood supply to the nipple can be maintained. But we rotate the nipple up, keeping it attached so the nerve supply, blood supply is maintained, and then bring the nipple up so there is a mastopexy or breast lift as part of the breast reduction. We take the breast tissue mainly out from the lower part or inside part of the breast, and then lift the breast after we remove the breast tissue. We take all breast tissue and send it into pathology. Do a fellowship at MD Anderson Cancer Center. We had actually 5 ladies, less than 25, all with breast cancer at the same time. So it's very rare, but when you have a big center, you're going to see a lot more anomalies and unusual things. We did a big study to look at breast tissue. The actual incidence of finding anything is extraordinarily rare. It's like 0.3%. So it's really rare to find any abnormal tissue. But we send all breast tissue out to pathology just to make sure that there's no abnormal cells or precancer or anything like that in there at all. So those are a little bit of differences between breast reduction and a full mastopexy.